Hello everyone, good evening. I'm Shreya Dhoundial. As always, it is very good to see you. Yesterday saw a milestone in India's vaccination drive. 86 lakh plus jabs in 24 hours. How was this achieved? Can the momentum be maintained? Do we have enough vaccines to inoculate everyone by the end of the year, at least the first dose? Those are questions we are asking and answering on Debrief today. Let's start by seeing how India achieved the record. First, of course, enough vaccines were supplied to states, 3 crore of them for the big launch on June 21st, which is yesterday. 80,000 vaccination centers were made operational that were giving the jab for free. And very importantly, what seems to have upped the enthusiasm is walk-in registrations, that you didn't need an appointment on the Covaxin app before coming to the vaccination center. The registration was done at the center itself. The top performer of yesterday's drive was Madhya Pradesh. In fact, 50% of jabs were administered in 5 NDA rule states yesterday. Here are more details. It's a milestone in India's vaccination drive. 86 lakh jabs in 24 hours. Double from a high of 43 lakh that was achieved on April 5th. The record came on a day that India revamped its vaccination drive. It's being called the Big Bang start to what the government ultimately wants to achieve. 1 crore jabs a day. 50% of the 86 lakh jabs administered on V Day was by 5 states. Madhya Pradesh, Karnataka, Uttar Pradesh, Gujarat and Bihar. All of them NDA-run states. Did they take up the challenge more seriously than the others? Let's look at Madhya Pradesh that topped the charts with 17 lakh jabs. They clearly had a plan in place. Madhya Pradesh had deployed 37,000 vaccinators in 7,000 centers across the state for the big day. MPs, MLAs and DMs were given specific targets. And Madhya Pradesh crossed its target of 10 lakh jabs for the day.
अलग तरह का उत्साह वैक्सीनेशन के लिए नजर आ रहा है। मकसद केवल एक है, तीसरी लहर हमारी जनता की जिंदगी को नुकसान ना पहुंचा पाए, क्योंकि वैक्सीन संजीवनी है, यही सुरक्षा है। इसलिए इस अभियान पे निकले। यह अभियान अब लगातार चलता रहेगा।
Indore was the top performing district with 2.21 lakh doses, which was almost double of what Delhi administered. Interesting to note that Madhya Pradesh had slowed down its vaccination drive in the run-up to June 21st. In the preceding week, jabs being administered were down by 22%. In fact, on June 20th, a day before the big day, only 692 doses were administered. Delhi, whose vaccination numbers were not too impressive, says they weren't given a single dose by the center on June 21st. And that more doses are being given to NDA rule states as compared to opposition-run states.
जुलाई के महीने के लिए मैंने पता किया कि जुलाई के महीने में क्या कमिटमेंट दे रही है सरकार। तो जुलाई के महीने में दिल्ली के लिए केवल 15 लाख वैक्सीन दी जा रही है फ्री में। तो 15 लाख वैक्सीन में कैसे काम चलेगा? मैं पूछना चाहता हूं केंद्र सरकार से कि जिसे आप दुनिया का सबसे बड़ा मुफ्त टीकाकरण अभियान कहते हैं, सबसे बड़ा हो ना हो, सबसे लंबा जरूर हो गया है और सबसे ज्यादा मिसमैनेज्ड है।
Politics aside, the question now is, can these numbers be sustained? A day after the 86 lakh record, 50 lakh jabs were administered in India. A back-of-the-envelope calculation shows that 160 crore doses will need to be administered by the year end to vaccinate all. With 193 days left, that translates into 83 lakh doses a day, 7 days a week. The hope is that with 80,000 vaccination centers operational, vaccine supplies streamlined and on-the-spot registrations, that impossible goal can somehow be made possible. It's the only way to keep India safe. In New Delhi, I'm Shreya Dhoundial. 86 lakh yesterday and 51 lakh today. The dip was expected. On an average, most experts are expecting 45 lakh to 50 lakh vaccinations to take place in a day. What we can also expect is the political tu-tu meme over vaccines to continue. After yesterday's record, as it were, the Congress tried to rein in the BJP's victory parade. Rahul Gandhi accused the centre of mismanaging the second wave and deliberately giving non-BJP states lesser vaccines. The Aam Aadmi Party joined in, and the BJP promptly launched Sambit Patra to counter these allegations. Here is who said what today.
मुझे तो कभी-कभी लगता है कि कंफ्यूजन और राहुल ये पर्यायवाची शब्द है। राहुल गांधी जी का नाम ही कंफ्यूजन है।
The fire and counter-fire continues over India's vaccination drive between the opposition and the government. The latest round started by Rahul Gandhi accusing the BJP of mismanaging the second COVID wave and making vaccination a competition between BJP and non-BJP ruled states.
It is pretty clear that the management of the first wave and the management of the second wave was disastrous. There were some central reasons as to why it was disastrous. We have tried to point out those reasons in our white paper. It is important that the government prepares itself for what is going to come. What does it mean to prepare itself? It means have the infrastructure ready, which was not ready in the first and second wave.
The BJP did not take kindly to it and in turn accused Congress-run states of fueling not just the second wave, but vaccine hesitancy as well.
मैं कुछ सवाल पूछूंगा और उसका उत्तर भी मैं ही दूंगा, क्योंकि हम जानते हैं कि ये उसका उत्तर राहुल जी नहीं देंगे। सवाल नंबर 1, ये जो सेकेंड वेव हुआ है, ये कहां से शुरू हुआ? कांग्रेस शासित राज्य से शुरू हुआ। सर्वाधिक मृत्यु किन राज्यों में हुए सेकेंड वेव के कारण? उत्तर, कांग्रेस शासित राज्यों में हुए। किन राज्यों में सर्वाधिक फैटेलिटी रेट, मृत्यु दर सर्वाधिक किन राज्यों में रही? उत्तर, कांग्रेस शासित राज्य। किन लोगों ने यू टर्न करते हुए डिसेंट्रलाइजेशन के बाद सेंट्रलाइजेशन चाहा? उत्तर, कांग्रेस।
The Aam Aadmi Party in Delhi has its list of complaints as well. It complained that on the 21st of June, when the new revamped vaccine drive was launched, Delhi did not get a single vaccine dose from the centre and that the centre was giving more vaccines to BJP-ruled states.
We have been receiving approximately between 13 and 15 lakh doses of vaccine as part of our central government and the state supply for the last 3 months. The problem, however, is that this speed of vaccine supply is just not enough. If we were to vaccinate 15 lakh people every month, then it's going to take 13 months to vaccinate the entire population of Delhi.
As this war of words continues, the opposition is also accusing BJP-run states like Madhya Pradesh of manipulating yesterday's record vaccination numbers. They say while Madhya Pradesh did vaccinate 17 lakh people yesterday, it is pertinent to note that on the previous day, that is the 20th, they vaccinated just 692 people.
Whether it's the state elections or the big one in 2024, one of the biggest health disasters in recent times, which is the COVID, is bound to be a poll issue, which is why the BJP and other political parties are a hammer and tongs and gunning for each other. And this acrimony is unlikely to end anytime soon. In New Delhi, Pallavi Ghosh.
Now, India is a country of 1.3 billion people. Our vaccination program started on the 16th of January this year, that is 156 days ago. Now, in these 156 days, 30% of our adult population above 18 and above, has been vaccinated with at least one dose. India wants to vaccinate the rest of the 70% by the end of the year. Is this possible in the next 192 days? Well, it is a race against time. Here is what the data is saying.
21 जून सोमवार से देश के हर राज्य में 18 वर्ष से ऊपर की उम्र के सभी नागरिकों के लिए भारत सरकार राज्यों को मुफ्त वैक्सीन मुहैया कराएगी।
But the country is still a long way from vaccinating 70% of its adult population that is needed to achieve herd immunity. India is working to scale up the pace of vaccination, and if it can vaccinate 75 lakh people a day, then it can wind up the vaccination of 70% of the adult population by this year end. Looks unlikely though, because the government's own estimate is that despite the June 21st record, 75 lakh shots per day is realistically achievable. 3 COVID vaccines are currently being used in India to vaccinate citizens: Covishield, Covaxin and Sputnik V. In all, an estimated 94.2 crore people, which means 200 crore doses will be needed to vaccinate India's adult population completely. How far have we got? 28.87 crore individuals, or 30% of the country's adult population, has been vaccinated so far. Out of this, 5.2 crore individuals are fully vaccinated and 23.66 crore individuals have got the first dose. But a large chunk, 65.14 crore people, are still unvaccinated. How long will it take? If India manages to vaccinate 75 lakh people daily, the vaccination drive will take 206 days to fully vaccinate the entire adult population. 174 days to fully vaccinate the 65.14 crore unvaccinated individuals, and 32 days to vaccinate the 22.33 individuals partially vaccinated. But do we have enough vaccines? BJP President JP Nadda says India will have 257 crore doses by the end of the year, more than enough to fully vaccinate the entire adult population. An advanced order of 100 crore doses have been placed so far.
मित्रों, ये बहुत बड़ा अभियान है और हमें ध्यान में रखना चाहिए कि this is the world's largest vaccination program.
Is this optimism shared by vaccine makers? Can they supply 257 crore doses by the end of the year? Here is how much they can produce and deliver in the next 6 months. The Serum Institute of India can deliver 75 crore Covishield doses and 20 crore Novavax doses. Bharat Biotech can deliver 55 crore Covaxin doses and 10 crore nasal vaccine doses. Biological E can deliver 30 crore Covaxin doses. The RFID can deliver 15.6 crore Sputnik V doses, and Zydus Cadila can deliver 5 crore doses of Zycov D. India is also exploring options to make the Pfizer, Moderna and Johnson & Johnson vaccines available in India by the end of the year. Bureau Report with Santosh Chaubey in New Delhi, Ayushman Singh Jamwal.
Let me go to someone who understands these numbers well. The numbers that we have put out, they can be a bit confusing, and puts these numbers and data in context for us. Dr. Chandrakant Laharia is an epidemiologist, also a public health specialist who has recently authored the book Till We Win, India's Fight Against the COVID-19 Pandemic. Dr. Laharia, thank you very much for joining us. I just want, we've put data for our viewers, and I know when you put it on television and when you're not actually reading it in a newspaper, data can be confusing. It doesn't always register. First things first, we have seen a high of 86 lakh plus vaccinations on June 21st. It is a world record of sorts. Can we maintain this momentum every day for the next 190 plus days till the end of the year?
So achieving 86 lakh for a day is a good idea. I think it shows the potential of India's vaccination program, especially when we are targeting something like 10 million shots a day or 1 crore shots a day to achieve the target of complete adult immunization in the country. However, we should be mindful that this kind of target or this kind of vaccination rate is possible only when there is sufficient vaccine supply. Now, if we look at the vaccine supply for next 6 weeks or 8 weeks, we know that in month of June, there will be around 12 crore shots or 12 crore doses available, which essentially translate into something like 40 lakh doses a day on average. Similarly, for month of July, the projected target by the government is around 15 crore, which can translate to a daily target of 50 lakh or 5 million shots a day. So essentially what was achieved on 21st June, 8.6 million, is not achievable at least for next 8 weeks. Maybe when there will be more vaccines available, as we have seen in the projections, but those projections are for a period of September or October. Like essentially, if we want to achieve a target of 1 crore dose a day for a sustained period of a month, then in that month, 30 crore dose should be available. And I don't see that kind of dosage available till mid-September or early October.
Okay, so what Dr. Chandrakant you're essentially saying is that India has the capacity to administer 86 lakh plus / 1 crore doses every day, but we simply don't have that amount of vaccines. Then how do you explain what happened today? 51 lakh plus inoculations.
So essentially, now let's go back to the numbers again. So for month of June, there were 12 crore doses which are available. Now for till now, till before 20th of June, on average around 3 million or 30 lakh doses have been administered in month of June. So essentially only 6 crore doses have been administered in 20 days. So remaining 10 days, we have another 6 crore. So the average for this period could be around 5 million or 50 lakh doses a day. So one day 8.6, another day 5 million. And then in the coming days also the similar kind of average of 5 million can be achieved. But we should also be mindful of variations amongst the states. For example, Madhya Pradesh state, and it was being discussed in your channel just now, Madhya Pradesh was doing very few daily vaccination till now. So they had an excess stock and they could utilize on a single day. But now we know, and this is in the news, that the available stock with the state government of Madhya Pradesh are now very little. They cannot sustain even that kind of coverage. So it is variable. In the month of June, we can expect that for remaining days also there could be 5 million shots a day. But that's the kind of average we can expect for another 8 weeks. It will not go beyond because there is not enough pipeline of vaccines in this period.
Okay, so there is not enough vaccines right now in the system to achieve a target of 85 lakhs or 1 crore doses every day. But that will change once more vaccines come in. Once you have reached a target of 30 crore vaccines in a month, once we have this sort of availability, then we will be in a position to inoculate more people. That is very clear. Now, Dr. Chandrakant, tell me, in your estimation and calculation then, by when will every adult citizen in India be inoculated with at least the first dose?
I think that is achievable for the country. That will a lot dependent upon the availability of vaccines and when those vaccines would be available. Let's assume that India would have sufficient vaccine as and when it is required. I personally foresee that a target of something like 90% of adult population with a single dose can be achieved by February 2022. So February 2022 is the target for 90% of vaccination. Now, remaining 10% of adult population can also be achieved if countries start focusing upon vaccine hesitancy right now. So current focus in the country is only on vaccinating individual, but we should be aware that there are people who are reluctant in the vaccination. And in my opinion, we are not paying enough attention. If we want to cover every single Indian, then there has to be a nuanced, granular, scientific strategy to communicate with those individuals. We need to scientifically understand that what are the reluctance amongst the people, why people do not receive vaccine, especially in the rural area, especially in those areas where we know there are pockets of vaccine hesitancy. So 100% of adult population can only be achieved if we focus upon assuring supply, ensuring timely delivery, but also on communication strategy, which is focused upon converting those individuals who are relatively hesitant. So I repeat, single dose of 80% adult population by February 2022, but it can be 100%. If it's vaccine hesitancy can be tackled.
Okay, last question, and I don't have too much time on this, Dr. Chandrakant. Double vaccination. How much time for that? And I ask you this question because right now, only 3.8% of our adult population is double vaccinated. And in the face of this Delta Plus variant, where we are being told that a vaccine like Covaxin is just 33% effective against the virus, double vaccination will become an urgent need. By when do you think the entire adult population of India can have both doses, realistically?
So let me answer the second part, that 33% of effectiveness against Delta variant is only for all kind of illnesses. But we need to remember that in India, our focus or priority of vaccination is to reduce hospitalization, to reduce moderate to severe illness and death. And against that, even this vaccine, currently available vaccine, is 70% effectiveness against that kind of disease. So there is no need of worry. Single dose is 71% effective.
Okay.
Now, when the both shots can be achieved, we need to remember one key point, that there is a time lag between administering first shot and then second shot. So somebody who received the first shot of, let's say, Covishield vaccine in mid-October, that person is unlikely to receive second dose before early 2022. Therefore, I personally think, since majority of vaccine supply would be toward the end of the year, by March or April 2022, majority of population, something like 80% or 90% plus, can receive both shots.
Okay, Dr. Leria, thank you very much for putting that data in context for us. It was quite illuminating having this chat with you. Thank you very much indeed. Now, India has set a world record on June 21st with the number of inoculations we have done. But where is India's vaccination drive when we compare it to other countries in the world? That is coming up next. Do stay with us. 86 lakh vaccines in one day. That's more than the entire population of Israel and Switzerland and twice the population of New Zealand. But unlike those nations, India simply does not have the luxury of a small population. So how does India rank up to the 30 most populous nations of the world when it comes to vaccinating its citizens? Shinjini Dev Burman has this report.
A record 86 lakh jabs have been administered on day one of the centralized vaccine drive. Over 28 crore have received jabs till date. For comparison, that is the entire population of the country of Israel. With the government taking over the responsibility of vaccine procurement as well as administration, the drive has picked up pace dramatically. Whereas a few weeks ago, people were scrambling for jabs, it's now a fairly smooth process. But India still has a long way to go. According to data, India is ranked 16 in the list of 30 most populous countries in terms of doses per 100 population. At 19.6 doses per 100, our level is less than a fifth of what the UK has achieved. The gulf between the UK and India is considerably wide. Over 45% of UK has been fully vaccinated. Only 3.6% of India is fully vaccinated. What is more concerning is the fact that the countries above India in this list are not all developed countries. China, Turkey, Brazil, Mexico and Colombia have provided shots to a larger proportion of their populations. Each of these countries have a bigger chunk of its population fully vaccinated than India. Another thorn in the flesh is the fact that countries ranked below India on this chart have been significantly less badly hit by COVID-19, as their cases and death data show. The only countries that were badly hit but still have lower vaccination levels are Iran and Ukraine. And of course, in the case of China, the breakup of numbers is not available. With over 1 billion doses administered in China, roughly 36% of the population would have received the first shot. The only respite is that the countries above India in this chart have also seen a much higher level of cases than India. True, the jab drive in India suffered due to supply issues in the past few months, hit also by the deadly second wave that devastated India in the month of April. With the centre launching a new vaccine drive, India is set to scale up inoculation. The target is set for 10 million doses by August, an ambitious target that will depend on the supplies. Whether that will be in time to defeat a third wave is something that remains to be seen. With Shinjini Dev Burman, Anusya Kumar for CNN News 18.
Enough vaccines, reducing vaccine hesitancy will be the key to vaccinating everyone in this country. It is a challenge for a country as big as India, but what needs to be done needs to be done. How soon we can vaccinate our entire adult population will be key to how we deal with the third wave. With that, it's a wrap from me. Thanks for watching.